Morning, and thank you again for being with us for our COVID-19 update. With us this morning, we're pleased to have Decatur Morgan Hospital President Kelli Powers. Kelli, thank you for joining us today.
Thank you.
And then with the Alabama Department of Public Health Assistant Administrator for the Northern District, Michael Glenn. Michael, good to have you with us, sir. So as of today, we have 17,211 total cases in Morgan County. That's an increase of 760 cases, or about 4.6 this week. I was looking at numbers this morning. I think it's about a 107 average daily average. Looking at the numbers from yesterday, somewhere around 130 plus cases were reported yesterday, positive cases. These triple digit numbers are very concerning. As reported by the Alabama Department of Health, the moving 7-day percentage positive rate is 21.8%. So approximately 40,900 individuals have completed their vaccine series here in Morgan County. You didn't tune in this morning to hear me preach. But we have around 123,000 residents. So, a third have actually been vaccinated. So with that, Kelli, if you'll give us an update from the hospital.
I will. We are up again. This morning we're at 57 inpatients. Friday we were at 44 at some point. Of that, the average age of those inpatients is 51, and only 9% of them are vaccinated. So, not good news. We have 1 PUI, 8 in ICU. The average age of our ICU patients are 61, and 0% of those are vaccinated. So, no one is vaccinated in ICU. Of those 8, 7 are on the vent. We've had several deaths over the weekend and since I was here last week. Very sad situations. We're holding 17 this morning in our ER. 9 of those are COVID positive, and the others are very sick as well, so a lot of sickness out there. This morning we have 196 inpatients between Decatur Parkway and Decatur West, which is a lot. Again, I can't say it enough, please get your vaccine. We are doing vaccines Monday through Thursday. You can walk in and get it. The number is 973-2888. We're doing Pfizer every day and Moderna now on Tuesdays and Thursdays. Remember to bring your card. But again, there's only 2 ways to get out of this mess we're in. To get vaccinated, or mask and social distance and just completely stay away from people. So I guess I'm at the point of begging now. Our staff is very, very exhausted, and so are our physicians. We're actually trying to work and do as much as we can to help and support our staff. If you do, become positive, we have information that we are going to begin handing out a little more detailed, Michael, at our testing sites. We're doing the mobile medical unit testing at Westmead Monday through Friday now, 9 to 2. We're doing it between 150 and 170 a day. And they said this morning there's already 25 or so cars lined up to start when they got there at 9. So just please, if you become positive, try to stay away from people, but also check your O2 sat. And when it gets below 90, we've got to get you help because again, you don't want to end up in the hospital or worst case on the ventilator. So we're doing the monoclonal infusions. We're doing 30 a day, trying to get to 40 a day. If we could add 2 nurses, I think we could get to 40 a day, which is all we have to do that. But Parkway, at the Parkway campus Monday through Friday, the number there is 973-2149. So if anybody wants to call and say, hey, I've tested positive, what do I need to do? Do I meet the criteria to get the infusion? You can call and ask them. We're still on red visitation at the hospital, trying to limit our visitors there and keep our staff safe. We need nurses. Again, I say this every week, but trying to even if you can just give me, 4 hours a day or a day a week, whatever we could do to help us would be great. We also need some volunteers. If there's anybody, whether you want to volunteer or come to work, I need people to answer the phone, make calls, schedule things like that, so we can take some of the clinical people and put them back in clinical roles. And again, I just want to reach out to the community. Everybody here was so great, and gave us meals and snacks and things like that. And if you could start doing that again, it would be wonderful. The staff are, not feeling as appreciated as they were, and they're working really, really hard for our community. So anything y'all can do to help them would be great. So, thank you.
Thank you. So now the mobile testing, you've increased the number of days from the last update that we had. How does it take for results to come back?
Well, it depends, and that's one of the things we're passing out, to let them know that if you do not get your results within 24 or 48 hours, those are not a rapid test, it's a send out. We're actually using another lab because the testing we have is limited. We do not have enough kits to test what we currently have now, so we used a different lab, and that's why we went to the mobile medical unit to keep people from coming to the ER maybe. But if you do not get your results within 48 hours, there's a number to call. The same 973-2888, and they can check on it for you. But we're trying to get all those back within 48 hours.
Okay, good. All right, Mr. Michael?
Well, I wish I had better news. Public health information just piggybacks on what the hospital just reported. Business is booming. Our testing has increased each of the last 4 weeks. Each week has been higher than the week before. When I left to come up here a while ago, all of our parking spaces where we're doing testing outside was full, so our nurses were humming this morning already in Morgan County. The sad part about this is preventable. It's so preventable. As Kelli talked about this morning, vaccination is our key to get out of this. As the mayor alluded to just a little bit ago, only 34.1% of the citizens of Morgan County have completed the vaccine series. 42% have gotten at least one dose. Our vaccination rates have increased a little bit. We've been averaging about 2,000 doses a week in Morgan County, which is not near enough. Testing is much higher than vaccination rates, and we would much prefer to use our nurses to vaccinate rather than the test. Testing is available Monday through Friday at every one of the health departments. Call your local health department, and we can get you in for testing that day. You walk in and get your vaccination, and we'll get you taken care of. We're doing the Moderna right now, and so you can get vaccinated Monday through Friday and get testing as well. When I went to work this morning, the urgent care indicator that I passed on my way to work, they had a line outside waiting on the doors to open this morning for testing. And so this is vaccine preventable, and so I would just beg people, urge people to go. If you're not being vaccinated, if there is a reason why not, please find out the answer to your questions if you have a question, because this is an unbelievably safe vaccine. As I looked this morning, there have been 369 million doses given in the U.S. Thus far. We've got lots and lots of safety information on these vaccines. These things are unbelievably safe. Out of the 1,230 deaths that have been reported in Alabama since April 1st, 91.2% of them are in the unvaccinated. Mm-hmm. This is vaccine preventable disease. And so all of these hospitals that are full, and I've got a list of 9 hospitals on the eastern side of North Alabama, and every one of them are the same. One of them is 100% unvaccinated, 86, 85, 94.5. All of this is just running right in line with the state averages. Right at 90% of all deaths and people that are in the hospital are unvaccinated. We can get through this if we would just get vaccinated. I would say protect yourself. Whatever that is, if it's a vaccine, do that. Wear your mask. And one of the encouraging things I saw this weekend as I was out at the grocery store, there were more people in masks that I looked around that didn't have a mask on. So that was the people that were unmasked was the exception, which was a good thing. So get your vaccinations, wear your mask, stay social distance, protect yourself, especially if you've got some comorbid conditions. If you've got obesity, heart disease, diabetes, respiratory issues, those kind of things put you at a greater risk for having a bad outcome if you get this virus. And so I would say protect yourself. Vaccine is the utmost of importance. But all those other things can help keep us safe as well. And so, I wish I had magic words to get people to get vaccinated, but all we do is beg. I really hate that the hospitals are full, but they are full. District-wide, we've got 109 people in the ICU, and 73 of those are on vents. There are some very sick people in North Alabama right now. And so and that's just COVID-related issues. We're not talking about those that have heart issues this week, any traumas that go along with in traffic, any other emergent conditions. Our hospitals are full, and we can take care of this COVID issue with vaccines if we just roll up our sleeves and get vaccinated.
Thank you, Michael. This morning we have some of our media partners with us. Laura Harkison with WHNT TV19 has joined us by phone. Lauren, do you have any questions?
Hey, Lauren, can you hear us?
Yes, I can. Hey, everyone. Good morning. So first I want to start off, Kelli, you had mentioned the hospital is looking for volunteers right now. Could you go into a little bit more depth of what kind of volunteers, maybe what experience they need, and also if y'all are still looking for nurses?
Oh yes, we're still looking for nurses. We're about 70 nurses down. So we have a lot of our nurses working overtime, at least 60 hours a week. Some of the staff's working, which it's not healthy for them to keep doing that. But volunteers, the main thing, calling these results back to people so they wouldn't be put in a position where they had to deal with any COVID patients and they could be, socially distanced, but just people to help call people back, schedule, things like that. So that the other people, we have some LPNs and people like that helping with that now, and I could transition them to maybe do something different, possibly even work with COVID patients, but just things like that, volunteers to help with more of the clerical work things.
Okay, thank you. And then also, I know we talked a little bit last week about the third vaccine dose that y'all are offering. Do you have any numbers about how many people might be taking advantage of that in Morgan County?
I do not. We are keeping up with that, but I did not bring that data with me this morning. I actually got my third dose last week, last Wednesday, and I'm still here. It doesn't even faze me, which is a little bit of a problem, I think, for me and my immune system. But I am immunocompromised. I take some medication that thins my blood every day, and so due to some health conditions, and so I wanted to go ahead and get mine because, again, working in the hospital, if I get COVID-19, it's going to be bad for me. So I took mine last week. We have a lot of people coming and getting theirs. If you are immunocompromised, and a lot of our elderly patients are, please come get yours so that you're covered with that. So, but I don't have the numbers.
Okay, I thank y'all so much.
Thank you. Thank you.
Thank you, Lauren. And then we have Eric Fleschauer with the Decatur Daily with us today. Hey, Eric. Any questions?
Kelli, you mentioned that you're down 70 nurses.
Mm-hmm.
And is that permanently down? I mean, you're actually needing to fill those positions permanently, or are these people that are out because of COVID exposure?
Both.
Okay.
Both. We've had a lot of people, go and travel, and then we have some that are out with COVID, or family members mainly, children with COVID, and then we're trying to open as many beds as we can and staff up, so some of them would be for that. I do have a unit we renovated that right now I can't open. There's 14 beds. If I could get it open, I would probably need, and that's not included in the 70, but I would need some more nurses to get that unit open as well.
Some hospitals have mandated vaccines for employees. Has there been any consideration of that? What are the pros and cons of a
Yes,
mandate like that?
we talk about that often. Because a healthcare leader, we want to promote vaccines. It's one of those things where I tell people your heart and your head say two different things. I don't want to mandate it because I'll lose staff. So I can't afford to lose these nurses that do not want to take it, and they go other places to work. So, right now we're sort of in a catch-22 on that. But yes, I would love to mandate it to make people, but I don't feel like we're going in that direction. So I just want to say that. I understand some of the young people's concerns with the vaccine, What I don't understand is the people who are 30, 30 on after childbearing age. I can't understand why they won't take it. But again, that's something maybe for the future that we can work toward.
Mayor, one question. Any plans on mask requirements for employees of the city? What kind of protections are happening here at City Hall?
So I sent out an email last week to roughly 525 of our city employees that strongly encouraged the wearing of masks. If someone comes in your office, you need to mask. That's really the only mandate. We're trying to avoid in-person meetings and going back to the old-fashioned phone call or doing virtual meetings. And then if we do need to meet as a group, we're trying to do that on the 7th floor where we have the ability to space with more people in attendance. So we're taking those type of precautions. Then, golly, I can't get this one. I'm gonna get close, Eric. But if you have close contact with someone who has tested positive, then city employees are to stay home for 3 days, and then they need to receive a test. Until they receive a positive test, then they would need to mask. It's been a couple of days since I sent that out, so I think I'm close to covering everything that was in that email.
Okay, thanks.
Okay,
I got one other thing I want to
ma'am?
I got one other thing I want to say.
Sure.
I've kind of struggled with whether I should talk about this or not, but I think for most people that know me, I like to help people. I mean, I think that's why I'm in the healthcare industry. I want to try to make this as simple for people to understand, but as we move forward in this crisis, there's not enough healthcare providers, there's not enough beds, there's not enough physicians for where we're headed with this, and I think we see it in Mobile and Montgomery and other places. At what point is there decisions made on who gets to live and who dies? And I thought about talking about it last time, but I didn't. But I think today, if I'm a citizen of Morgan County, I want to be on the living side of that. And what I'm seeing in the hospital today, there are people, and I'm not just saying this to try to get money or anything. I'm saying this because if you want to live, you need to take that vaccine, because we are having people that die every day begging for the vaccine, begging to live, leaving children behind, leaving spouses behind. There's no reason they should have died. And at some point, we will get to the point where we're at the point now where we're overwhelmed. We're not at the point yet to where we pick who lives and who dies, but I believe we're not too far away from that as a state. And if you ask Scott Harris that, I think he will agree with you.
Dr. Harris had a little stronger message Friday. And then to add on to what you just shared, to be in that position by yourself, because you have no visitation, right?
Right, we have no visitation. Mm-hmm.
Yeah,
yes, that's right. It's
tough.
tough.
Well, look, as we move into the long weekend, we get ready for Labor Day. Please remember to take care of yourself and others. If you want to get vaccinated, you can visit the health department, the Decatur Morgan Vaccine Clinic, or go to vaccinefinder.org to locate an additional vaccine provider. And we certainly hope that you will do that. On an unrelated matter, Hurricane Ida came ashore yesterday in Louisiana. We are waiting. FEMA has reached out to us as a municipality to provide assistance with our fire department, waiting for another call to come in as to when they will be dispatched to head south and where they'll actually be deployed. But this morning I've received emails from various department leaders confirming that we're ready as a city for Ida based on the forecast. Our street and environmental department, mostly streets, they go out and spend a lot of time working to make sure that our drains are clear and we'll be able to handle the water that comes through. We are located next to a river, so there are exceptions whenever flash flooding comes through. And then our tree crews, they're ready and prepared in the event that they're called upon. So that said, until next time, be safe and be kind, and hopefully we won't have to come back here in the near future. Take care.